Year 11, just the latest of the videos for the medicine exam next week. Trying to sound a little bit more charismatic, but unfortunately I'm at home and the family are upstairs trying to go to sleep, so I've got to be fairly quiet while I'm doing this. Now, just to go through theme 5, patient care, because I've done theme 1, it's already on the YouTube channel. I've done theme 6, so theme 5 is the only other one that I think may well come up now. Just very quickly, I'm going to try and get through this in under about 5 minutes, so it's a bit easier to watch. Now, basically, use the word patient care over and over and over and over again. Whatever you talk about patient care. Now, patient care is really, it's hospitals. Until you get to liberal reforms, it's basically just hospitals, and more hospitals, and our hospitals changed over time. Now, we know in the medieval period, hospitals were run by the church, and that involved things like almshouses, which basically looked after people who were at the end of life, old people, poor people, etc., etc. Monasteries, run by monks and nuns, care for the sick, and you had leper hospitals on the outskirts of town, which meant that basically everything was controlled by the church, which meant that whatever ideas that the church had were the ideas that hospitals had effectively. So, stuck around in terms of medical treatment, the ideas of Galen, Hippocrates, and the four humors, because that's what the church liked. Now, if we talk about negatives, obviously it's that the church controlled everything, which meant new ideas couldn't come to the fore. If we talk about the positives, actually Christian hospitals were relatively decent compared with hospitals in the early modern and definitely in the industrial period of time. So we don't just 86 the medieval period and say that everything was rubbish and the churches were awful. There were actually some positives there. So that's the main bit for that. So just emphasise the positives and emphasise the negatives. Okay, now as we enter into the early modern era, one thing that really gets on my nerves is patient care actually takes a rapid move backwards because of Henry VIII closing down the monasteries. Now, obviously, the monasteries and the church were the only people that provided patient care. Now there's no one, which is a real negative backward step. And it takes about 200 years for this to turn around. Yet everybody starts telling me that Henry VIII is the best thing since sliced bread and to do wonders for patient care because endowed hospitals are created. That's absolutely not the case. It's definitely not his intention. And actually, it literally moves patient care into almost nothing. And we know that from looking at basically the Elizabethan era, where there's huge amounts of poverty caused by the Henry VIII basically shutting down the monasteries and getting rid of the Catholic Church. However, the positives that come out of it are the removal of the church from patient care means that whoever controls patient care can actually bring in new scientific ideas. So what we start to see in the early modern era is a scientific approach in endowed hospitals, basically means funded hospitals. And we're talking about hospitals that are funded by charities, they're funded by wealthy people. So they tend to have different names, although some of them stay the same, like St Thomas's is a church hospital, it's also an endowed hospital, and it's now an NHS hospital. Okay, but in the basically the early modern era, you get hospitals like St Thomas, St Guy's, Westminster, and the one that I've listed down there, the Matthew Bolton Hospital, was set up, and they were a little bit better at providing the latest treatments, which were based on actual scientific approach, things like bone setting, removal of bladder stones, etc., etc. So we do see some improvement towards the end of the early modern era. Now, if we move into industrial / modern, more the industrial, initially there's a massive step back due to overpopulation. The population's gone from 4 million in the Elizabethan era, 150 years later, and it starts to move close towards 40 million in a very short space of time, which means that 7,000 odd endowed hospitals in England are nowhere near enough to cope. And there's 11 in London, it's not even scraping the surface. So basically, patient care overall takes a step back, even though we know that medicine's making huge strides forward. So on the one hand, you've got hospitals that are able to branch into doing things like eyes, nose and throat surgery. You've got germ theories on the horizon. You've got the likes of Simpson, Lister, etc. But it's not translating into hospitals because hospitals are not really sufficient. There's not enough people funding them. Government's laissez-faire. and the standard of nursing and the standard of hospitals generally for ordinary people goes rapidly downhill. And that's where Florence Nightingale fits in. She goes to the Crimean War, proves her ideas on nursing, comes back to England and makes those reforms happen, which means that at the end of the industrial period we start to move forward again, having taken about 5 or 6 gigantic steps back. Now that takes us into the modern era, and patient care changes drastically, largely because governments stop being laissez-faire. They start to worry about the health of the population, largely because we haven't got soldiers fit to fight in wars like the Boer War. Booth and Rowntree did some surveys and realised that everybody's got diseases like rickets, scurvy, whooping cough, and we are way behind the rest of Europe. So things start to change in the UK, and liberal reforms are a big change to improve our patient care. Now, liberal reforms are quite difficult to remember because they're not really to do with hospitals, but they are to do with our health and welfare, i.e. we get free school meals for children, we pay national insurance, which then pays into pensions, pays into sick pay, pays into benefits, etc, etc, etc. So they are a gigantic step forward, although they don't stick around for long because World War I effectively kicks them into touch. Now, after World War I, we start building new houses. Again, that's a big step forward in patient care in terms of like people's welfare is looked after by the government, so another step away from laissez-faire. But it's not until the end of World War II that we actually really properly end up with something that works for everybody, which is the NHS. And the Beveridge report into the State of England reports that basically we have 5 evil giants. We've got want, ignorance, disease, squalor and idleness. Now, in order to tackle disease, we need something that provides free dentistry, free GPs, free hospitals, free ambulances, free vaccinations, free x-rays, free scans, basically free everything. And that is where we end up with the NHS. Now, to draw a line under patient care, since the NHS has been created, we now, on average, have a life expectancy of over 70. Whereas before 1948, that was down into the 50s, just over 60s for women. So, huge steps forward in the modern era. And that really is what you need to get across. Just mention that the NHS today provides free healthcare for all. So patient care has gone from the church to the government's responsibility. Okay, thank you for listening and good luck with this one if it comes up in the exam.